Hello everybody. So today we will be discussing about the various instruments and implants used in spine surgery. So the commonest instrumentation system and the commonest surgery which is being performed in spine surgery is posterior spinal instrumentation using pedicle screws and rods. We have been discussing this in various sessions that after the advent of pedicle screws or the design of pedicle screws, there has been a significant revolution in the field of spine surgery. Because basically these pedicle screws, it is passed from posterior through the pedicle into the vertebral body. So it has hold over the three columns of the vertebra, the posterior column, middle column as well as the anterior column, and you will be able to manipulate the spinal unit or the vertebral unit as a whole using the pedicle screws. And it is supposed to be one of the biomechanically stronger constructs, the pedicle screws and rods, compared to other instrumentation technique. So in this session, in this module, we will be looking at the various instruments and the implants which is used for pedicle screws, and a short demo of how to insert a lumbar pedicle screw using a sawbone model. Okay, now let's jump into the session. So if you can see in this table, you have various instruments. So there are n number of instruments. As you know, orthopedics and spine surgery is a field of armamentarium. You have to deal with various hardware stuffs, but it may look complicated, but I will try to make it very simpler and easier to understand. Let us discuss each and every instrument based on the steps of how we are going to do a particular procedure. For example, a pedicle screw fixation. So suppose if you want to put a pedicle screw in a lumbar spine, what are the things that you need apart from the general instruments? I am going to talk about specific instruments which are specific to pedicle screw fixation. The first instrument which we need is this. This is called as the awl, or it is called as the starting probe. You can see it has a handle, silicone handle, and it has a sharp tip or sharp point. This is otherwise called a sharp point. So it all depends on the place where you get trained. So based on the place of training, you name it as awl or starter or sharp point, whatever it is. So this is what is called as the starting awl. Using this instrument, you will make an entry point in the bone. So that is why it is very sharp. Once you insert this awl, you may go up to 10 mm, maximum of 10 mm or 5 to 10 mm, or sometimes we use it only to make an entry, especially in case of osteoporotic bone. So this is called as the sharp point or starting awl. The second most important instrument is the probe. This is called as the pedicle probe. Some people may call it a sound, but the common term which we use for this particular instrument, it is called as the pedicle probe. It comes in two varieties. One is a straight pedicle probe and the other one is a curved pedicle probe. Curved pedicle probe is that the tip of the probe will be curved. That is otherwise called as a Lenke probe. So I'll tell the advantage of that and its use. So before that, you have to know, so this is the tapered end of the probe and it has markings. If you can see, it is marked as 10, 20, 30, 40 and 50. Basically, it is to know how far you are going inside the bone. Normally, when you insert a pedicle probe from the posterior aspect, from the starting point, you will enter up to 40 or 50 mm in the lumbar spine. In L1, L2, it will be up to 40 mm or 45 mm. For L4, 5 or S1, it will be 40 or 50. If you are entering into the S1, and if you have a very good medial trajectory, this may enter to up to 40 or 45 mm, or it will usually stop at 35 mm. So using this probe and using a gentle rotatory movement, you will be entering into the bone or into the pedicle. Through the pedicle, you will be entering into the vertebral body. So this is called as the pedicle probe. It has a handle and then you have a metal tip. Sometimes when there is sclerosis, when you touch the posterior vertebral border and when it is sclerotic, it is difficult to enter the posterior vertebral border, and it is very rare. Most of the times you will be able to insinuate this probe without any issue. In those cases, you can use a mallet and give a gentle tap. You can see the metal over the silicone and you can give a gentle tap, 2 or 3 taps, so that it pierces through the posterior vertebral border. Once you insert the pedicle probe, the next most important instrument which you have to use is something called as the feeler. This is called as the feeler, or otherwise it is called as the ball tipped probe. You can see the tip of the probe, it is ball tipped. So what is the purpose of this probe? So once the probe has entered into the bone, you use this feeler to enter into the bone, and you have to palpate for the 4 borders of the pedicle. One is the superior border, the other one is the inferior border, the medial border, the lateral border. This is how you have to palpate. You may not have so much space to palpate. I'll just show in the sawbone model of how you are going to do or how you are supposed to do it. Normally you would have seen surgeons, they will just probe it like this and you will get a sound like tuck tuck tuck. That is not the purpose of this probe. Actually what the surgeons do is they probe over all the 4 walls to look for any breach in the pedicle wall. This is the most important step. As we know, when you are inserting a pedicle screw, medial breach and inferior breach has to be avoided, and it is dangerous because when there is a medial breach you may injure the dura, and when there is an inferior breach there are high chances that you will injure the nerve root. So this probe is used to probe or feel the walls of the pedicle like this in 4 directions, and sometimes you have a curved probe. Okay, sometimes it will be difficult for you to feel the medial wall, so you can use this curved tip of the probe to feel the medial pedicle wall. So this is called as the feeler or the ball tipped probe.